Okay, my name is Regan. I will be giving Llewellyn Sanderson her potassium and morphine today. I'm going to start with going over her patient chart info. So her name is Llewellyn Sanderson. Her date of birth is 117XX. She's a full cold. She's allergic to sulfa. She's a high fall risk. Her medications are morphine, acetaminophen, potassium chloride, and normal saline. She had an appendectomy as a child. That's the only medical history that's on here. She fractured her tibia, that's why she's in here. And her heart rate is 95, blood pressure 134/82, respirations are 19, SpO2 are 98% on room air, and her temperature is 36.6. So that's all good. Heart rate and blood pressure are a little high, but that's okay. She's currently resting in her bed and she is alert and oriented. And then everything else looks good. Her lab of potassium's a little low. It's a 3.3. We want that in the 3.5 to 5 range. She's currently in a 9 out of 10 pain, which is why we were giving the morphine. So yeah. I'm gonna do my first med check while I'm outside the room. This is when I'm like grabbing the medication. So I'm just gonna compare it to the paper chart for this, but I have the MAR set up in her room, or when I get in the room. So I'm gonna do the morphine first. So with the morphine, some nursing considerations and side effects. It can cause sedation, it can cause constipation, it can cause lower blood pressure, and it can cause respiratory depression. So I'm just wanting to really make sure that I don't give it to her unless her blood pressure is higher or above the normal range, and her heart rate, I want that to be a little higher, as well as her respiration rate. If that was like 10 to 12, I wouldn't give it to her, but she's all in that range, but I'd want to assess it when I get in there, just to make sure. And then this is about the normal dose of the morphine that is given. It takes about 20 minutes for its peak effect, but it works within minutes. She's not allergic to it. It's sulfa, and that is not in here, so that is good. It is morphine. She's given morphine. Her patient is Llewellyn. She is Llewellyn. It's 2 milligrams per milliliter. Yep. IV push. For pain, this is for moderate to severe pain, and she is within the 7 to 10 range, and because she's 9 out of 10. It's given as needed every 4 hours. She hasn't been given it yet, so we can give it now. And then I'm going to do her potassium. Also checking to make sure that both packages are intact. They're not expired. They're both, this actually has 1 milliliter in it, and the potassium is compatible with the normal saline. And when I'm doing the checks, I want to make sure that there's no distractions. So then for the potassium, just some nursing considerations. This can cause hyperkalemia, so I want to make sure I'm watching for that, and then putting her on cardiac monitoring if needed, and then also telling her that if she's having any weird feelings in her chest, then she should let me know. It can also cause burning and discomfort at the IV site. So this is potassium chloride for Llewellyn Sanderson. It is 10 MEq in 100 milliliters. Yep. It's given for low potassium. She has lower potassium. I'm giving 100 milliliters to infuse over 2 hours. Medication, yep. Time. It's due now. And yeah. So, right dose, right drug, right patient, right time, right indication, and then it is given by the IV infusion. So, yeah, and all the packages are good. And I'm just gonna grab my supplies. And then as I'm preparing the medication, I'll go over my second med check. So I'm going to do that one more time before I go into the room. So Llewellyn Sanderson, this is morphine, 2 milligrams per milliliter. Yep and yep. It's push. Yes. It's for moderate to severe pain, which she is in. Yep. It is due now. Yep. So right time, right route, right patient, right drug, right dose, and right indication. And then for the potassium, yep, 10 MEQ in 100 milliliters. It's potassium chloride. It's for Llewellyn Sanderson. It's given by the infusion, and it's due now, and it's because she has low potassium. Yeah, so both 2 med checks done. Now I'm gonna grab my supplies, go into the room. So I just knock, provide privacy. Llewellyn?
Yep.
My name is Regan. I'm going to be your student nurse. I'm going to be giving you your potassium and morphine, okay? Can I get your last name and date of birth?
Sanderson 117XX.
Perfect. I'm just going to check that wristband. Yep, looks good. You are Llewellyn Sanderson. And your date of birth is 117XX. Before we get started, do you have any allergies?
Just sulfa.
Okay. Perfect. That's what your chart says. And so then I would log into the computer. I'm going to scan her wristband. That's what I would do normally, but since I'm using the patient chart. So now that I'm at the patient bedside, I'm going to go over my 3rd medication check. So for the morphine, it is morphine. Her name is Llewellyn Sanderson. It's IV push. It's 2 milligrams per 1 milliliter. It's for moderate to severe pain. We can give it now because it hasn't been given in the last 4 hours. For potassium chloride, it's potassium chloride. It's 10 MEQ in 100 milliliters. Llewellyn Sanderson. It's for low potassium. We're giving it by the infusion, and then it's due now, and it's it's for right drug, right time, right patient, right dose, right indication, and right route. And then after I'll give it, I'll make sure to document. So that's same for the morphine. Okay, so now I can give the morphine. So Llewellyn, I'm gonna give your morphine first. Okay, so this is for your 9 out of 10 pain that you're having. I'm also making sure I'm assessing the IV site for any infiltration or redness or swelling, anything like that. This might make you feel a little drowsy or lightheaded. It can also cause some constipation or some slow or shallow breathing, so you just let me know if you have any side effects. Also, since she has a high fall risk, so if you have any dizziness or lightheadedness, please let us know and we'll help you adjust it all, okay? Are you in a comfortable position before we get started? Are you in a comfortable position before we get started?
Yes.
Okay, sweet, thank you. Okay, so now I'm going to give her IV push. So I'm going to put some gloves on. Okay. This will just take a few minutes for it to work, and then you should start feeling the effects. And then about 20 minutes after is its peak effect, so about 20 minutes after, that's when you should feel best, okay? I'm going to stay in here a few minutes after to make sure that we're not having any adverse reactions or allergy. So, yeah, if you have any questions for me, feel free to ask. And if you are in any pain, please let me know this, especially when I'm administering this. So I'm just going to clean this for 15 seconds. And I'm going to wait for it to dry, because otherwise the germs don't die. Okay, and then for the saline, I'm just going to pull back, then push up until it comes to the top to get all the air out. Okay, perfect. So I'm just going to put this on here. Okay, now I'm going to start pushing this in, so if you have any pain at all, you just let me know.
Okay.
And then I'm watching for any signs of infiltration or anything. Nope, that's all good. There's no resistance. You still feeling good?
Yep.
Okay. I'm gonna untwist that off. I'm gonna take another Oco prep pad. I'm gonna clean it for 15 more seconds.
I'm gonna assess your.
Okay, then we're gonna do the morphine. Now with the morphine, it's very important that I push it for 5 minutes, the 1 milliliter. I'm gonna pull back. We don't wanna lose any medication. Get all the air bubbles out. Okay. So I'm gonna push that in here. So I'm gonna push for 5 minutes. Any pain?
Nope.
Okay, so after 5 minutes, I'll take this off. And then I'm going to flush, or I'm going to clean it one more time. 15 seconds. Let it dry before I do it. And then I'm going to take my last flush. I'm going to put that in there. And I'm going to push the first milliliter, since that's the same as the morphine, for 5 minutes. And then I can push the rest the same. So I'm just gonna push that first milliliter very slowly. And then after I can push the rest the same just to flush it. Watching for any resistance. Okay, and you're feeling good still?
Yep.
Perfect. And I'm not seeing any signs of infiltration. Okay, so we did our third check on potassium already. But it's for Llewellyn. I'm just gonna go, and then I got my IV tubing. Oh, and then also for that, I would make sure to document it after I gave it to her if I had the MAR, so I'd be scanning her barcode and the medication, and then documenting that I gave it to her. Okay. Okay, so for this part, I'm gonna hang. Oh, actually, I gotta grab a
I will be pushing the morphine in over 5.
I'm gonna hang this on the piggyback. This. Perfect. Okay, and then I'm gonna make sure that this is clamped shut. Yep. And then I'm gonna keeping this sterile. I'm gonna take this off. Pop this off. This has already been used, so there is some fluid already in the tube, but I would make sure I have a brand new tubing and potassium. And then push that in there. Okay. And everything looks good. That just goes in there. So then before I flip this up, I'm going to make sure this is rolled down. Got the cap still on. So then I'm going to prime the tubing. Push this up here. And I'm just going to watch. Well, then I'll fill this halfway. Perfect. Okay, then I'm just going to watch this flow down. Watching for any air bubbles.
How does that feel? Are you feeling okay?
Yep. Okay, they'll reach the end. So take the cap off. And then I'm going to grab this before I touch this. Make sure this is clamped. I'm going to scrub this hub for 15 seconds. Okay, and then I'm going to let it dry before I hook this.
So next I'm going to assess your IV site here.
Okay. Now I'm going to unclamp. And I'm going to put the infusion pump to 50 milliliters every hour because we're giving 100 milliliters over 2 hours. So then this should start dripping once I do that. Yep, it is. Okay. So I infused it, or I put the infusion right into the pump. Okay. And then I'll take my gloves off. Put some foam. Okay. Now there is some burning for the IV site, so, and discomfort, that's common. But if you have any pain at all, let me know. Okay, so we can address that. How are you feeling?
Good.
Okay. So scan the potassium, scan her wristband, make sure it's in there. And then after I'm done with that, I'll log out of this. Okay. So before I leave, I'm just gonna be in here for a few minutes, clean up her room, and make sure that she's not having any allergic reactions. Are you in a comfortable position?
Yep.
Perfect. Well, I will just check on you in a few minutes. You have your call light. You can just pass out in your bed. I'm going to make sure the bed is all the way to the ground and that she has her rails up. If you need anything at all, you can let me know, and I can help you with that because she is a high fall risk and I don't want her falling. So I'll let her know to report any side effects, and I'll make sure her heart is being monitored for the potassium. And if she doesn't show any allergies, then I can leave after a few minutes and I'll come back. Okay?
Mm-hmm.